Okay, thank you very much. So, in the first talk, Dr. Rothman had mentioned the need to engage psychologists, which I appreciate when it comes to health behavior in these patient communities, and that was a great actual segue to what I'm going to do, because that's actually what we're trying to do in my lab, is to think about ways we can intervene on health behavior, leveraging patient communities on social media. Let's see. Okay. So my clinical expertise is in weight management counseling, and I don't know if you guys are familiar with the Diabetes Prevention Program, which was a very large multi-site trial looking at the efficacy of a lifestyle intervention that involved diet, exercise, and behavioral modification counseling compared to metformin and placebo on diabetes incidence. And what they did is they recruited people with pre-diabetes and randomized them to these three groups. And to make a long story short about this, what they found is that they were able to get modest weight loss, but perhaps even more impressively, the lifestyle intervention group reduced diabetes incidence more so than both placebo and metformin. And they've been following the cohort for many years later and found effects out to 10 years, even with some weight regression. And there have been large, very similar studies in both Finland and China, as well as a host of studies doing translational work in all kinds of different settings, from community settings to clinics and so on and so forth. So very impressive work by this group. To give you an idea of what that lifestyle intervention involves, it's pretty hefty. The first 6 months is considered the core, and this is 16 visits with a clinician, typically a dietitian or a behavioral counselor. And they also had some exercise groups where people would come in and could exercise in groups. Then there's a maintenance phase that went out for 2 years, and they continued the face-to-face contacts at somewhat less frequency, but at the very little, or at the very minimum, every 2 months. But the counselors were encouraged to see the patients as much as needed, and on average they saw them still be weekly to bi-weekly. So this is a lot of face time. They also had telephone calls in between those face-to-face contacts, and these group courses that lasted 4 to 8 weeks and were focused on a particular topic. So this is a profoundly intensive, expensive intervention. They really threw the kitchen sink at these patients to get them as much support as they needed to manage their weight, diet, and physical activity. They also had this little toolbox, which basically was giving resources to the patients. It could be anything from cookbooks to vouchers, paying for an exercise class at the local gym, meal replacement shakes like Slim Fast, and these types of things. On average, they spent about $100 a year per patient on the toolbox kit. So the bad news is that this intervention hasn't had an enormous impact on diabetes in the country or in the world, in spite of its wonderful findings. And really it comes down to, it's a burdensome, expensive intervention, lots of patient visits. Providers don't really have this kind of time to spend with patients, an hour a week with patients. There aren't good reimbursement models right now for this type of work. That's a little bit changing, but the reimbursement models actually don't match what was actually done in the intervention. And most providers don't have this training, including dietitians. While they know nutrition counseling, they're not necessarily trained in behavioral modification or in exercise counseling, which are both kind of fields in themselves. So in terms of reach and dissemination, this wonderful intervention hasn't really gone very far. The YMCAs have actually, many of them have picked it up through a program through the CDC, so that would be sort of one case of where it has somewhat disseminating. So I became interested in the last few years in social media and thinking about, social networks as a way to implement and disseminate behavioral innovations in a way that could be much more scalable. And so for those of you who may not be familiar with social media, it's basically that term refers to any website that allows users to interact and exchange information. Facebook, anybody here on Facebook? All the Facebook users? Oh my. And how many people on Twitter? Okay, so some tweeters. So these are pretty standard commercials, online social networks. So I was also struck by some research that shows that obesity may be socially contagious. And so many of you may be familiar with Christakis and Fowler's work, where they found that individuals with obesity were more likely to have obese friends, neighbors, spouse. So there are connections that were not genetic or familial connections. There's a clustering of obesity. So it may be the case that either birds of a feather flock together or we influence each other. And since 2007, there have actually been several studies that have come out that show that health habits, so behaviors specifically, are actually shared in social circles, whether it's smoking, eating fruits and vegetables, using fitness apps, these types of things. So the challenge is, if we want our patients to get healthier, we really hope that they would have some sort of social network or community that would support those behaviors. And the good news is, when they begin to adopt healthier behaviors, there may be an effect on their community. A lot of my patients have told me that a big challenge for them in trying to manage their weight is that their social world is sort of working against them. So they'll say, I don't have anyone to exercise with, I have to make a separate meal for myself, my friends aren't really into this. So they really feel like an island when it comes to all the different behavior changes they're trying to make. And honestly, those are the patients that tend to sort of drift back to some of their old habits. And I think it's because of the social context of their behavior. So as I got on Twitter several years ago, I noticed this phenomenon that I'm really fascinated by, and it's called peer-to-peer healthcare. That was a term coined by Susanna Fox, who was formerly at the Pew. And it's this idea that patients do want to connect with other patients. And the last time they looked at this phenomenon, the Pew did, was in 2012, and they found that about a third of internet users have actually gone online to read about somebody else's experience with a condition. So this is different than going on WebMD and looking for your, trying to diagnose yourself. This is maybe going on Facebook and joining a diabetes community, or going on Twitter and trying to find someone else who has breast cancer and that type of thing. A recent study, this just came out a few months ago, what they did was they wanted to study the breast cancer community on Twitter. So this is an organically developed community on Twitter, and you can find it through the hashtag BCSM, which stands for breast cancer social media. And so people who use that hashtag either have breast cancer, or they might be a patient advocate or a family member, they might be a doc, a nurse, or anybody that has any interest or something to do with breast cancer. So what this study did is they surveyed people with breast cancer who engage in that community to kind of find out what they were getting out of it and whether it's changed anything in their lives. And what they found was that the vast majority did feel like engaging in this community really increased their knowledge about their condition. 2/3 reported far less anxiety about their condition because they engaged in this community. And a third, I think this is very interesting, actually showed evidence of increased patient activation, which is something that we're always trying to struggle with, is how do we get patients more activated when it comes to self-management. So engaging in these communities seems to have an impact on behavior. So my interest is in obesity, and so as I'm seeing these patient communities sort of organically developing on Twitter, I thought, well, geez, I wonder if this is happening for obesity as well. And so I anecdotally saw many people on Twitter kind of tweeting their way through a weight loss attempt. So for example, you might have somebody on there who, in their bio, it says, I'm a mom of 4, and I'm a dog lover, and I knit, and I'm trying to lose 50 pounds. And if you look at their stream, they're tweeting all about that process. So they might say, I lost 2 pounds this week, or I just signed up for a 5K, or I gained 2 pounds. And they're going on and on, kind of documenting through tweets their weight loss. And I thought, well, this is kind of fascinating because weight loss tends to be a kind of more private experience, but these people are so public about it. So I'm curious why on earth they're doing this. And so we did a study to interview them and ask them that very question. What do you get out of doing this? Because I'm a psychologist, one of the things I presume they're getting out of it is social support. But I also know on social networks there's this concept of the troll. And this is kind of the mean person who goes around and just tries to say nasty things, and there's a lot of stigma when it comes to obesity. So I was also curious about their experience with negativity online. So we asked them questions to rate their Twitter connections on these different outcomes, as well as their offline friends, their family members, and their Facebook connections. So we tweeted out our survey and got 100 people to complete it, and we basically just said, do you tweet about your weight loss journey? If so, complete a brief survey. And we surveyed these areas of weight-related social support and then weight-related negative influence. So things like embarrassment, how embarrassed do you feel when it comes to these people, around your weight, how judged do you feel by these people. Here's what our sample looked like. So basically we pulled a highly female sample, about 38 on average years old. Of course, they were in the obese range. We also asked them this question: how much weight have you lost so far in your current weight loss attempt? And obviously it's self-report, so you never know kind of the veracity of it. But on average, people said almost 44 pounds, which is a pretty decent sized weight loss for anybody. There's a huge variability, but the median was still about 28 pounds. So these people, for whatever reason, seem to be fairly successful losers. So in terms of positive influence, and again, we had them rate each of these 4 categories of people in their life. And we found that they rated their Twitter connections as the highest in positive influence or social support as it pertained to weight loss, which I thought was interesting because on Twitter, for those of you who use Twitter, you'll know this, but for those of you who don't, the vast majority of your connections are actually strangers. They're not people that you've met offline. In terms of negative influence, again, we saw that same pattern where they rated their Twitter friends the lowest, so their least source of negativity, which I thought was interesting. So there wasn't this reason to believe that these people are getting trolled all the time. And another interesting finding, I think, is that that tallest bar there happens to be family. So I guess what I learned from that, if you want to be judged or feel embarrassed, there's really no reason to leave the house because they're family members. But perfect strangers may be a better source to share your troubles. So it may be the case that people who tweet about their weight loss are lacking that support at home. And that's why we're seeing the family members aren't being super helpful, their friends aren't being super helpful. And it may also be the case that social networks are very handcrafted, particularly on Twitter. So if there's somebody who's obnoxious or you don't like what they're saying or they're trolling you, there's a button that you can push that makes this person gone from your life forever. Now that button does not exist when it comes to family members, unfortunately. So it's easier to sort of handcraft and make that social network what you want it to be, and that may be why it's so positive and not negative. Even on Facebook, your Facebook friends, it's a little bit more difficult to get rid of negativity. Now they have the unfollow where you can you don't have to unfriend somebody, but you can hide their comments, or you can go so far as to just pound on that unfriend button and sever the relationship. But that can sometimes have consequences too. My sister got unfriended by somebody recently, and of course she calls me up. Did you know that so-and-so unfriended me? And so there's a drama around it. Twitter, this doesn't happen. You don't know the person. No one's going to call you. There's no social consequence. So you can make it what you need it to be. So the fact that people are doing this organically, they're searching for other people to support and be supported by, we began to wonder, then can we take our behavioral interventions and deliver them using these modalities? It seems like there's a place for us there, especially because on Twitter, for example, there's a lot of sources of bad information when it comes to health. A lot of people go on there, very entrepreneurial. They'll give themselves a title, like I'm a wellness activist. Like, what is that? And then they'll get enormous followings and give all kinds of health advice about how people should be eating and how they should be exercising, and not all of that is very evidence-based. So we thought we need to be in there with the evidence base and as providers, and maybe we can create networks where we're actually delivering something that's useful and effective. So we did a series, we're sort of in the midst of a series of iterative pilots to really this is very proof of concept to figure out how can we do this? Is it feasible? Would people like this model? Will they be interested in signing up for it? And would they stick around on it? So here, I'm going to present the first 4 of our iterations to you. So the first group is actually a more traditional group. We did 10-week versions of these lifestyle interventions. 12-week versions of these lifestyle interventions. So the first one is traditional. So actually is no social network in that one. It's just having people come in for their weekly meetings and getting the lifestyle intervention content. In the second one, we added the Twitter community. So we connected everybody on Twitter with each other and with the coaches using privacy settings. So what we were doing was not public. I historically have a big interest in people who not only have obesity but also have depression, and felt like that particular population might be in the greater need of the social support. And so in that iteration, we did specifically recruit people with depression. In our third iteration, it was similar to our second, but did not select for people with depression. And then our final iteration, we dumped the group visits altogether, with the exception of one, and did all of the counseling in the online group. So in terms of privacy, like I said, we had people come to an orientation meeting to set up their Twitter accounts, and we used privacy settings and said use pseudonyms and avatars, so anonymize yourself so you can be whoever you want to be. And here's a good example of somebody you can't tell exactly who they are. They got creative. I'm not sure why that is their bio, but we certainly can't identify that person. And so sometimes people would get fun with it. That's not actually a member of our group, but I thought that was a funny one.
I think that's on the wall behind you.
Oh, I know, yeah. Maybe she works here. So then we had to think about how do we bring content to people. We don't want to just create a community and hope they chat and that kind of thing. There's got to be some meat on the bones of this. And so we created a content library, which turned out to be actually quite time-consuming. So the DPP Lifestyle Intervention Manual, I kid you not, is about this thick. So we're thinking, how on earth do I get this on Twitter? And so we basically went through all of our materials and turned them into tweets or online articles that we wrote. And we made sure that those articles were written very kind of blog style or online article style. So 800 words or less, lots of images, engaging, very different than the way academics write and that kind of thing. And then we would tweet those out. And in the same way, we would carry on the lifestyle intervention where each week there would be a theme or a topic, and then all of the tweets would be kind of according to that. Then we use an approach that I call micro-counseling. So instead of having people come in for a visit and doing the counseling all in one visit, what we would do is sort of this approach where it's very much like you would experience on social media. You post something in the morning, and then later in the day, all these comments are happening. So the conversation is sort of happening asynchronously throughout the day. And so whenever somebody happens to log in, they put in their 2 cents and contribute to that conversation. That way people can do it when they're free, when they're available, and not have to rearrange their schedule to come to a meeting. And then we would try to be strategic with our posts. So weekends tend to be tough for people trying to lose weight. So on Friday afternoon, we would start a discussion around how to deal with your weekends to kind of get people in the mindset right at the time. Whereas in a traditional group, maybe they're meeting Wednesday nights, that's our only access to them. We don't really have the opportunity to cue them at other times of the week. So here's an example of one string. So one of the participants posted, and this is, I think, last year around Halloween. So this is what my work does on Halloween. Does anyone else get a sugar rush just from the smell of sugar? So she posted at 11 or 8:30 a.m. And here's kind of the replies and the timing of them throughout the day. So be strong, someone said, step away from the break room, and so on. And the coach about 9:30 chimed in with some advice. And then later in the day, it was nice because this person came back and it sounded like they were really thinking about this and got a 5K going, which was great. So we have that opportunity to sort of in the moment support. And we would encourage people to do that. Like if you're confronted by a temptation, take a picture and post it. And those posts actually got the most action. People would just be all over it and be really supportive around it. There was even one guy who was on his way, I think he's driving somewhere, and he's like, you guys, I had a horrible day. I feel like stopping at McDonald's. And all these people chimed in immediately, and they're like, don't do it. And, and then he reported back later, he's like, thanks so much, you guys. I didn't go. I got through it, and I really appreciate your support. And then there were people much later who hadn't logged in, throughout the day, and they were like, how did it go? And so, and normally you wouldn't really have an opportunity for that in the moment support. Like, you wouldn't call up your friend and be like, I'm thinking about stopping at McDonald's. They'd be like, I'm at work. Like, why are you calling me about this? So in our pilot series, we had a total of 45 participants. And again, these studies seem to be drawing white females who work full time. So that's interesting. We didn't do any targeted recruitment. We just sort of recruited broadly in the community. So in terms of our findings of our 4 different iterations that I'm going to talk about, so our traditional weekly visits, this is, we have the sample size for that iteration, whether they were depressed or not, and really we only had one that was. The percent losing greater than 5% of weight, and then how many dropouts. And so in that first iteration, we got about 25% losing about 5% or more of their weight. In a full 6-month version, you would expect that number to be about 50%. So in half the time of a usual intervention, we got about, half of what we would expect, or half of, if it were 6 months long. So that's about what we would expect. So when we added the Twitter group but kept those weekly visits and people with depression, they didn't necessarily do any better or worse. But our focus group data found that particular group wasn't hugely enthused about the Twitter part of it, and I'll talk more about that later. In the third group that did not have depression, these people were a little more positive about the Twitter part of it, and 36% of them lost clinically significant weight, which is that 5% mark. And then our final group, where we didn't have any but one single visit, 42% lost clinically significant weight. And what we thought was interesting about that is we were concerned about getting rid of all of these in-person visits, that people might, something might be lost. But we weren't concerned anymore because it did seem like they did just as good, if not a little bit better, than the other groups that did have those weekly visits. And so from this point on, we have not been using any visits. So we've been able to completely get rid of visits, which is great, and still maintain that level of weight loss. And you can see how much they engaged in terms of their tweets. That's the average over the course of 12 weeks. So people are tweeting, just about over like 10 tweets a week, so just more than once a day. Other results, we did find that how much people engaged was associated with how much weight they lost, and other studies doing online versions have found that same phenomenon. So engagement seems to matter, and it may be that people who are doing well engage more, or it may be when people are engaging, they're getting more out of it. We did some focus groups to ask people, so what did you think? What did you like about this? What did you not like about this? And they said what we loved was we love reading about other people's experiences. So they love the Halloween donut post. They love when people would post things about themselves, ask for help, start conversations. They love the accountability. They said I felt like it nudged me, so I might be going through my day. I check my Twitter and I see that you guys are there, and then I think, I got to make a healthy choice. And the social support. The biggest barriers, they said, was some people would say, I just didn't know what to post. I didn't know what to say. So there may have been some discomfort around posting to strangers. And then some people were very new to the Twitter platform and had a little bit of trouble figuring it out. So we do think that is a very feasible approach. When we're using an unfamiliar social network, we probably need to make sure that we're training people enough on how to use that social network. But one of our conclusions that we've been thinking about and doing with our current iterations is this engagement conundrum. People love to hear from other people who are struggling, but then at the same time they feel uncomfortable about sharing their own struggles. So what to do about that, and really how to get people engaging more. So we were funded, and we're just starting a large trial based on these pilot studies, and it's a non-inferiority trial where we want to compare fully powered version of this Twitter-based intervention to the traditional face-to-face, a bazillion meetings type model. And we're doing some cost analyses there and looking at predictors of weight loss in that online version so we can kind of better understand for whom would this sort of work the best. And I think there's some people who probably won't like this type of model because they're not comfortable engaging in social networks in this way, and then the other people who love it and love the fact that they don't have to come into the medical center. So that's what we're launching literally as we speak. So we've continued to iterate, and one of our more recent iterations, we just did this over the summer, so this is kind of, we just got this data available, is we wanted to understand, how to get people chatting more and engaging more, because engagement seems to matter and people want to hear from each other. And there's this study of online social networks for smoking cessation over in the UK, that what they did is they have these large online social networks, and they found that there's a small percentage of users that they would call super users. And these are people that are on there all the time. They facilitate discussion, they're always posting, and in this study they found that these people were very instrumental to recruitment, to retention, and just very valuable assets to the network. They would do peer coaching just on their own volition. And they called them super users. And so I thought, I need some super users is what I need. But how do I find these people? So I don't know how to find them, so I figured maybe I'll try to make them, and we'll see what happens. So we randomized 56 participants to 2, now we moved to Facebook weight loss intervention conditions. And in one, we had 3 people that we randomly selected and incentivized them to be a super user. And we gave them a prescribed posting schedule. And then in our other group, it was kind of like our Twitter groups. There were no super users. We were just doing the online coaching. And the coaches in each condition were blind. They didn't know if they had the super users or not. So we wanted to know, is it feasible to incentivize people to be a super user? Like, can you make somebody that person? Will they do it? And then what will they post? And will their engagement boost the engagement of the rest of the group? And perhaps then as a result, improve the weight loss of that group. And so those were the questions that we asked. So this is what we told our super users. Post a status update to the group at least twice a week. Ask questions or reply with comments to the counselor post. Comment on your fellow group members' posts. We'll give them $25 a week for 2 weekly posts and 7 comments or questions. And if by day 5 of the week, if they were falling behind on their schedule, we would just send them an email and say, hey, by the way, you still have 4 posts to go, so just letting you know. What to post, this is the guidance we gave them, pretty much verbatim. We said, post the successes or difficulties you're having in your weight loss. Ask questions to the weight loss coach or to the group, or share your favorite recipes, post a picture of your healthy food porn, or local events you're attending, this type of thing. And we gave them some examples so they would have an idea of what we were talking about. So they were in that secret Facebook group for 12 weeks. We had no intervention visits, just an orientation to get them set up. We used the same content library that we had developed, and we automated our part a little bit more in this version, in that we scheduled our content posts 2 a day. And then all the coaches needed to do is go in there and kind of answer questions and sort of get that conversation going. And we had coaches log in twice a day. And then every Friday we'd have a post where people weigh in and would report how much weight their weight has changed for the week. So not their actual weight, just whether they were up or down or the same as last week. So these are the characteristics of the participants, and they're very similar again. We're pulling kind of a white female population in this, and so I think if we want to target other groups, we might have to make the intervention perhaps more tailored or do more targeted recruitment. So did the super users engage more than others? Again, we incentivize these people, so I hope so. And we did find that they actually did follow their homework assignments. They all got incentivized for all 12 weeks, which is great. And here's their level of posting relative to everyone else in the study. So these were the 3 people who got paid. So that's great. They did it. So then we want to know, did the super user condition engage more than the standard condition? So did those super users boost the engagement of their condition? And so the answer is kinda. When it comes to original posts and comments, we did not see a difference between conditions. But when it came to like and overall total engagements, we did see that the super user condition was more active. And of course, we eliminated the actual 3 super users from that. In terms of weight loss, what did that look like? I took the super user condition apart in terms of the super users themselves and the regular users, and then you can see that they're all, there's a row for all as well. So in terms of the super user condition, they didn't do too badly and not horribly differently when it comes to percent losing clinically significant weight loss than the standard condition. This isn't powered for a weight loss difference, but we just want to look at least trends to see, could this be preliminary data for a larger, fully powered grant. Interestingly, our super users were not so successful. Even though they were posting away, they weren't losing very much weight. And the mean there is dragged down a little bit by one of them who didn't lose any weight at all, and the other 2 did lose some weight. It's only 3 people, so it's hard to make sense out of a mean. But in terms of the rest of their group, they did pretty well. Our standard group didn't do so well, at least in terms of mean weight loss, although their numbers for average losing clinical significant weight were pretty similar to the other 2 groups. In terms of dropouts, our super user group actually had really good retention, so we were very pleased by that. So in terms of the super user activity, so anecdotally, I noticed that as I'm watching my super users, they weren't following instructions so much in terms of they seem to be posting a lot of advice-giving articles. So I felt like they were trying to mimic the coaches a little bit. So here's an example of what one of them posted. So it's not so much of that sharing of your experience and kind of thing that we were hoping for. So even though they did their assignment, they kind of did it in their own way. And maybe you can't sort of incentivize people to share about themselves, and if they're not comfortable doing that. So right now what we're doing is content analyzing their posts to kind of get an idea of what posts of the super users did generate the most engagement and what generated the least engagement. And we're also doing that for our own posts for the intervention. And something that we're thinking more and more about is how do we identify and harness the real super users? So someone for whom this is their personality, they're on there, they're very engaged, they like to chat with other people, and they're totally willing to share about themselves. So we're thinking more and more about how to do that. And I think as the community grows, those individuals will appear. It's somewhere between maybe 5 to 10% of a community. So if you only have 20 people in a community, it's very likely you won't have any super users. So as the community grows to maybe 50 or 100 or more, you're going to get more super users in there. And having multiple super users might really help get those discussions becoming more alive. And so we're thinking about expanding the size of the community to hopefully get some more natural super users. Another thing that we're doing, towards that end is allowing the community to grow organically. So a study that we're starting very soon, we're recruiting for now, is we're going to let people invite their friends to the group. And so we're going to do this on Facebook, and because we think that maybe people will engage more if their close ties are in the mix. So if you think about it, if you go to a party by yourself, you're probably less talkative than when you go to a party with your best friend. And you're kind of disinhibited, you feel more comfortable, and you engage more with the party. So we think maybe we should let people bring in their close and trusted friends who are also trying to lose weight and just let the community grow as big as it gets. And so one of our questions is how big is it going to get if we let people do that? And does this concept of having people invite their friends predict their engagement and their weight loss? And will people like it and want to do that? Or will they feel uncomfortable with that? So those are the questions that we want to find out. So finally, another thing that we're thinking about is we feel like this could be a more scalable approach than that traditional diabetes prevention lifestyle intervention, which involved all of those visits. And if we can prove that this modality is efficacious at changing weight, right, helping people lose weight and prevent diabetes, then leveraging these larger patient networks that are out there might be a means of scaling this and getting larger dissemination. So some of the things that we're thinking about is how can we get viral participation and how would that work? In one study one grant that we're resubmitting this month, we're looking at whether we can leverage influencers on Twitter to promote the studies that we're doing and bring participants into them. And on Twitter, there are all kinds of influential users that have very big communities that they influence, and so how can they be engaged to help disseminate whatever innovation we have. And so kind of, you guys probably remember the Ice Bucket Challenge. This is something that, went viral and, generated millions and millions of dollars for an organization. And so there is this capacity for virality. And so I'm really interested in thinking about how we could study that and understand what are the characteristics of things that could really, really spread through social networks that would influence health behavior. So please follow me on Twitter if you're there. If you're not and you're a Facebook user, we do have a Facebook page called UMass Health Center. So if you just do a little search, you can like our page and learn more about some of the stuff that we're doing and some of the stuff that we're excited about.